Joined here right now by the Minister for School Standards, Nick Gibb. Good morning to you, sir.
Good morning, Julia.
And thank you very much indeed for joining us. Now, today you're looking at a new regime being backed by the Education Secretary, your boss, Gavin Williamson, to make schools mobile phone-free zones. I'm stunned that every school isn't already banning mobile phones. Why not?
Well, a large number of schools, of course, are doing so. And it is proving to be an effective way of making sure children are not distracted by the phones. And of course, excess use of mobile phones can affect children's mental health and their well-being. So we're very keen on making sure that the practice of those schools that do ban mobile phones during the school day is spread across the system. And that's why today we're announcing a call for evidence on that issue, but also how we continue the drive to improve behavior in our schools, both disruptive behavior and low-level disruption in our schools. One child misbehaving in a classroom can affect that lesson for all the other children in that classroom. And we want to make sure that we have calm, ordered classrooms where children can work hard and study and do well without being bullied and without the fear or noise of the interruption of others. And that's what this call for evidence is about today.
I'm amazed there needs to be a call for evidence. It's blatantly obvious. I don't really think this is something that is even up for dispute. But I'm fascinated the Education Department is calling for evidence on something they're going to make in terms of how something affects children, because there was never any evidence looked at specifically about children wearing masks in classrooms. That was imposed without any new evidence being presented at all.
Well, we published the advice of Public Health England, of SAGE, when we make these decisions. All those sorts of decisions are based on the evidence of our scientific figure.
Yes, no, there was the evidence didn't advise masks, and there was no new evidence that was presented to suggest that masks were needed, and they were imposed on my child and my listeners' children for months on end. My daughter's school, they're still back in the classrooms as well. There was never any evidence presented that made any difference. Let's talk about. We talk about low-level disruption in the classroom. I think a lot of parents would rather their kids were facing a bit of low-level disruption in the classroom rather than being stuck at home. We've seen some extraordinary statistics showing up to 250,000 pupils being forced to self-isolate at home, despite only 9,000 positive tests. I think those are on lateral flow tests, and therefore, 60% incorrect. And so a tiny number of children, most of them not even ill, most of them not even having a symptom, testing positive for COVID, forcing out huge numbers of children to stay at home for 10 days, even if they're not ill at all. Lots of calls for that to end, including from the Children's Commissioner, Dame Rachel de Souza. Is there going to be a new system in place for this autumn school term, which is not going to force whole year groups, whole classes, large tranches of schools to be forced out because one child tests positive?
Well, we do want children to be in school. That's why education is a priority. Schools were the last to close, the first to open as we deal with this dreadful pandemic and this virus. There are a whole raft of measures in schools to minimise the risk of transmission, the hygiene, the extra ventilation, the staggered breaks and so on, the bubbles, to try to do everything we can to minimise that risk of transmission and keep children and staff safe. We are conducting a trial at the moment of daily contact testing to see if that is an effective way of enabling those that have come into contact with somebody with COVID to avoid having to self-isolate.
So that would, instead of them having to self-isolate, they take a test, and if that's negative, they can go into school and they just keep taking a test every day.
Yes, and we just want to, we're trialling that in a small number of schools to make sure that it is an effective alternative. And that trial ends, I think, tomorrow, and we'll look at the results of that. Well, you talk about the numbers of children self-isolating. It is about 3% at the moment, figures we announced recently, of pupils who are self-isolating because they've come into contact with somebody with COVID. It is important that those lateral flow tests keep taking place by children at home twice a week, so we can identify anybody who may not be showing symptoms but does have COVID, so that they don't go into school.
Except these tests that you're advocating, they are so unreliable that they have been withdrawn by the company that makes them, Innova, in America. They've been banned by the Food and Drug Administration in America. The Innova have actually said that anyone with these tests should destroy them or return them to the company because they're basically all but useless. Why on earth are we still using them for millions of pupils?
Because they're not useless. The lateral flow device test high viral loads, and that's when you are at the most infectious, and you get the results within 30 minutes. If you do test positive, there's a requirement then to go on to take the laboratory-based test, the PCR test, to confirm that positive test. But they are extremely effective, and
why do we think they're extremely effective in this country, and the Food and Drug Administration doesn't think they're effective in America? Talk me through the science, capital T, capital S.
Our scientific advice is that testing using LFD tests that detect the virus when there are high viral loads, and you get the result instantly, are a very effective way of identifying people who don't show symptoms but are nevertheless carrying the virus.
They can miss a majority of positive cases, but they also get. I mean, they have false negatives and false positives on such a rate. I mean, you could just flip a coin and get similar results, couldn't you?
No. This is identifying many thousands of people who don't show symptoms, and as a consequence, they're not taking that virus into classrooms to spread the virus. It's a very effective way of identifying asymptomatic. 1 in 3 cases of COVID don't show any symptoms, and that's why it's important to use this test to identify everybody we can.
Okay, let me ask you about that video of Chris Whitty. He's been harassed in the street. The third time a video has emerged of Professor Chris Whitty, the Chief Medical Officer, being harassed in the street. 3 thugs, 2 grabbing him round the neck. I think they think they're being playful. They're not shouting abuse or that, but nevertheless, clearly assault, and clearly very, very frightening for Chris Whitty on his own. What do you make of that video and the attention that Chris Whitty has had?
Well, I think the scenes in the video are absolutely appalling, and I don't think there's a viewer of your listener to your program who would not condemn those scenes. Chris Whitty has done a magnificent job as Chief Medical Officer over the whole period of this pandemic in providing very good advice to government, keeping our NHS safe, saving lives, and we all owe him a great debt of gratitude. And the police are now investigating this appalling scene, and I hope that the full weight of the law will land on those culprits.
Just finally, I know you need to go, but do we owe a debt of gratitude to the Health Secretary, Matt Hancock, as well?
I think we do. I think he has been a very good Health Secretary during this pandemic, indeed before. And if you think about what's been achieved, he has managed to ensure that the health service has been able to cope despite all the pressures on it. And we have one of the most successful vaccination rollouts in the world. 85% of adults have now had at least 1 dose, 60% have had 2 doses, and we hope that all people over 18 will have been offered a dose by the time we reach July the 19th. He admits himself that he made a mistake. He should not have breached the social distancing rules, and that's why he took the decision to resign on Saturday.
Oh, so he wasn't sacked. The Prime Minister seemed to imply on yesterday that he was sacked.
Well, this story broke on Friday, and by Saturday we had a new health secretary. There's a very swift period of time between a story breaking and the resignation occurring, but it's clear that Matt Hancock took the decision to resign, and that decision was accepted by the Prime Minister.
Minister for School Standards Nick Gibb, really appreciate you joining us.